This presentation will examine the United States healthcare delivery system and its three main components: providers, settings, and purchasers. The Agency for Healthcare Research and Quality describes the goal of our nation's healthcare system as providing efficient, affordable, high-quality medical care that prioritizes patient safety and well-being, is culturally sensitive, and patient-centered. This complex system operates under a combination of private and public health insurance providers. Public health insurance is largely funded and managed by the federal government. Medicare and Medicaid are the most widely utilized programs of public insurance coverage. Private health insurance, or voluntary health insurance, is chiefly employer-based, but may be also purchased individually. Healthcare reform is a challenging policy issue that is often the subject of political debate on a federal level. It is important for Americans to stay up to date with these current issues to be aware of their right to high-quality care. Additionally, health inequities intensify when attitudes, skills, or behaviors cause harm to personal or community health. Peterson, Charles, and Young, and Coyle emphasize that understanding the fundamentals and inner workings of this complex system will promote health equity by aiding individuals in making informed decisions about their health and well-being. First, we will examine several types of healthcare providers and discuss how they contribute to equity in healthcare access. A healthcare provider is an individual or organization that delivers healthcare services. She and Singh offer examples of physicians, hospitals, and medical equipment suppliers. Primary care providers manage a patient's overall health needs. Hospitals and similar medical facilities offer coordinated medical care that address minor sicknesses, critical illnesses, and surgical recoveries. Medical equipment suppliers manufacture resources necessary to conduct medical care, including medications and medical devices such as hospital beds and mechanical ventilators. Nurses and dentists are two other examples of healthcare providers. Nurses prioritize holistic, patient-centered care and often act as champions in patient advocacy. Dentists not only offer routine oral care and surgical intervention, but they also provide education regarding nutrition and dietary recommendations. The goal of a medical provider is to coordinate and deliver efficient, high-quality, patient-centered medical care. This often presents itself as distributing health education, diagnosing and treating acute and chronic illnesses, and promoting an awareness of preventative care to encourage long-term patient well-being. Primary care physicians, for example, often aid patients in managing all aspects of health. For some patients, these providers focus their care on educating and guiding patients through healthy lifestyle education. Other primary care providers coordinate patient care in more complex hospital environments. Hospitals and medical facilities act as healthcare providers as they are encompassed by healthcare teams and professionals that provide a multitude of medical services to patients with a wide range of medical needs. The family medicine and research centers emphasize that, regardless of their specialty or focus, medical providers and healthcare organizations prioritize promoting overall health and well-being, improving quality of life, and respecting patient preferences throughout every stage of care. Medical equipment suppliers also aim to meet this goal by providing healthcare professionals with the equipment needed to optimize patient well-being. Nurses are considered providers as they perform comprehensive patient assessments, develop care plans based on patient needs and health goals, and deliver safe, efficient, high-quality care. In some care settings, nurses spend more time involved in direct patient care than any other medical provider. Nurses may operate in a variety of settings, including hospitals, physician clinics, birthing centers, and schools. The primary function of most dentists is to provide oral care services. This may present itself as routine cleanings, cavity fillings, or surgical interventions such as tooth extractions. Dentists also play a vital role in nutrition health. They provide counseling services on the impact of eating habits, guidance on nutritional deficiencies, and preventative care recommendations. Inequity in healthcare occurs when the health status and distribution of healthcare resources differ among different populations or groups of society. These disparities are often rooted in socioeconomic, racial, and ethnic inequities. Healthcare providers can improve equity by improving access to care and becoming involved in policy changes to reduce the rates of uninsured individuals. According to the University of Southern California, community outreach efforts and chronic disease management programs advance health knowledge in affected populations. Healthy People is a national initiative aimed at improving health nationwide by providing 10-year measurable health goals and resources to both measure and achieve these objectives. In 2021, Kleinman and colleagues authored an article explaining the Healthy People 2030 initiative. According to this research, Healthy People 2030 aims to promote health equity by encouraging community health literacy and increasing social cohesion. Medical professionals echo these goals and encourage patients that healthcare equity becomes possible when communities are united in strategies and goals, such as presented in Healthy People 2030. Primary care physicians specifically may promote equity by performing a comprehensive assessment of the healthcare needs of their community. For example, the Journal of the American Board of Family Medicine conducted research on the healthcare accessibility of rural areas. These locations are the most consistently documented to have the poorest access to mental health services, worst population health indicators, decreased testing for chronic disease, and increased risk of lacking other vital healthcare resources. Primary care providers can utilize telemedicine to enhance healthcare access to this population. Cunningham, Polomano, Wood, and Asola stressed in their research that hospitals and other healthcare facilities can address inequity by incorporating health equity education in their leadership strategies and mission statements. Hospital leaders can educate their employees on the appropriate language, meaning, and application of health equity-related terms, such as a requisite to building knowledge. By leading community health program initiatives and promoting cultural responsiveness, these organizations can also improve healthcare accessibility. Medical suppliers conduct research that surveys patient demographics and assesses the need for medical resources in a given patient population. Hoyer and Associates note that this research is used to define health equity and may help advance efforts and collaborative action to improve health and well-being for all. Nurses promote equity by upholding standards of excellence in care. Nurses perform comprehensive assessments of their patients that include identifying potential health disparities. They construct their plan of care for these patients based on these specific needs and preferences. Furthermore, nurses improve health care accessibility by assisting their patients with care coordination. Case managers in a hospital setting, for example, advocate for their patients by communicating with both physicians and insurance providers to establish a patient's discharge needs are appropriately evaluated. Dentists advocate for preventative care, especially in patients with high risk of developing harmful diseases. In this way, they promote equitable treatment by striving to address health disparities before they develop or worsen. Many dental offices are well known in their communities as they participate in outreach programs that provide basic education on oral health and nutritional well-being. Here we will review various settings of healthcare services and explore how each contributes to equity and healthcare accessibility. A healthcare setting is in any facility or organization where healthcare delivery takes place. These settings may provide services that address acute or long-term medical needs and may occur in inpatient, outpatient, or long-term care facilities. Inpatient settings include acute care hospitals, rehabilitation centers, and psychiatric hospitals. Many individuals require inpatient care to receive more intense medical monitoring and observation. This vital care may present itself as recovery from major surgery, prolonged treatment for life-threatening illnesses or injuries, extensive diagnostic and laboratory services, and committed clinical counseling and therapy services. Outpatient services may offer surgical intervention, diagnostic services, observational studies, consultation appointments, and rehabilitation services. She and Singh offer examples of outpatient settings such as clinical offices, emergency services, home health care, and women's health centers. Long-term care involves prolonged medical care for patients not able to independently perform activities of daily living, such as bathing, eating, or dressing. Long-term care centers include facilities such as nursing homes and assisted living facilities. Social determinants of health are non-medical factors that influence health and well-being. These include income, education, food, and housing. Virginia Commonwealth University School of Medicine determined that by performing a comprehensive assessment of a patient's social determinants of health upon admission to an inpatient setting, healthcare providers can utilize resources to address these needs and better prepare patients for discharge, even involving diverse patient populations. Outpatient settings improve accessibility by reducing out-of-pocket expenses and offering shorter wait times and easier scheduling for specific medical services. Long-term care incorporates high-quality, individualized, holistic care that entails patient values, beliefs, and concerns being assessed and incorporated into a plan of care with long-term goals in mind. This design of care promotes patient well-being by developing therapeutic rapport and increasing beneficial health outcomes. Additionally, it is vital that long-term care services are efficiently integrated and carefully coordinated with other aspects of non-long-term medical care. For example, a case management team may assist a long-term nursing home patient to create and attend an outpatient appointment at a local dental facility. This integrated and coordinated care is crucial to patient well-being as it further promotes accessible holistic care. Efficiently providing these services to long-term care patients demonstrates an understanding of a patient's comprehensive health needs, promoting health equity. Finally, we will define 3 types of healthcare purchasers, explore what they do, and review how each creates or addresses equity in healthcare access. Healthcare purchasers are individuals, organizations, or programs that pay for healthcare services. These services can be purchased through private insurance companies, government agencies, or even individually. Individual insurance plans are coverage options that cater toward people who do not have access to employer-based insurance coverage or are not eligible for Medicare, such as those who are self-employed, college students, or early retirees. Tikkanen and Associates describe the Centers for Medicare and Medicaid Services as a federally orchestrated insurance program that make up the largest purchaser of healthcare in the United States. Private health insurance purchasers, or voluntary health insurance, include companies such as Blue Cross Blue Shield, Cigna Healthcare, and United Health Group. Private insurance is often employer-based and is the most usual form of healthcare coverage in the United States. This coverage involves employers, group plan sponsors, and even the federal government to a certain extent. The Congressional Research Service notes that the federal government often regulates private insurance and provides tax benefits related to this insurance. Private insurance policies offer financial protection against potential future medical expenses. A premium is the amount the insurer charges for specific healthcare risks. These premiums also exist for the individual insurance policyholder. Premiums, benefits, and deductibles, however, differ greatly in price between employer-provided and independently obtained healthcare coverage options. Medicare is a government program that aids qualified individuals to cover medical costs. She and Singh explain that coverage options are for those 65 years and older, disabled individuals who are entitled to Social Security benefits, and people with end-stage renal disease. The Centers for Medicare and Medicaid Services run this federally administered program. Jointly funded by both federal and state governments, Medicaid eligibility is based on individuals' financial status. Those eligible for coverage include families with low income, children, and people with disabilities. Rudowitz, Burns, Hinton, and Mohammed suggest that by supporting more than 90 million low-income Americans, Medicaid is the nation's primary program that provides comprehensive coverage for both acute healthcare needs and long-term services. Individual insurance policies promote access in healthcare by offering personalized plans to protect and enhance patient well-being. Private insurance companies improve access to medical care and aim to reduce health disparities. These programs are associated with significant improvements in access to care, the use of preventative services, and self-reported health. Individuals with chronic conditions reported improvement medication adherence and more efficient communication with physicians. Medicaid services are a major source of healthcare coverage for those suffering healthcare disparities. Medicaid expansion is an ongoing operation seeking to increase coverage options for more individuals. Medicaid expansion aims to increase access to primary and preventative care for low-income adults. The Center on Budget and Policy Priorities reports that racial, economic, and health system disparities narrowed in some areas since the Affordable Care Act's first major coverage provisions began in 2014. Determinants of health equity such as economic stability, education, and healthcare systems are both interrelated and interdependent. Rubin, Croscall, and Lukens raise awareness to the fact that political movements such as the Affordable Care Act influence both social and economic landscapes. Strategies to promote health equity must be adaptive strategies able to respond to these changing landscapes. Medicare coverage options aims to encourage healthcare coverage and access to services such as obtaining prescription drugs, hospital services, and long-term care. In conclusion, the United States healthcare delivery system is unique and complex. The three most impactful components of healthcare delivery, providers, settings, and purchasers, work together to achieve a common goal, the delivery of safe, efficient, high-quality medical care. Equity and accessibility must be prioritized when developing a patient's plan of care. Healthcare providers may promote equitable healthcare accessibility by performing thorough research to identify the inequities and disparities in a given community and subsequently engaging in community health education programs to address these needs. Providers may also offer continuing training on strategies to address equity and accessibility to both current and future healthcare providers. Healthcare settings such as inpatient, outpatient, and long-term care facilities may confront equity and accessibility by addressing a patient's social determinants of health, reducing out-of-pocket expenses, and prioritizing holistic, coordinated care respectfully. Healthcare purchasers address equity and accessibility by incorporating adaptive strategies to promote increased coverage options for those most at risk of suffering healthcare disparities. Finally, Peterson and Associates remind us that understanding the vast inner workings of our healthcare delivery system will encourage an awareness of patient rights and aid individuals in making informed decisions of their health and well-being. Thank you for watching.